Oligohydromnia, so it's opposite to the polyhydromnia, where the amniotic fluid is less than the 500 ml and the index is less than 5 centimeter, and the vertical pocket is less than 1 centimeter. So you can see here this oligohydromnia, the image, so we show there is low level of the amniotic fluid. Okay, so and there is small size abdomen, and the other etiology depend upon the what etiology. For example, if they are preeclampsia, which causing the oligohydromnia, so there will be other sign symptom associated with the preeclampsia. Okay, so but the major sign is the small size abdomen. Okay, so and if you look at the index, so of course the index vertical pocket is less than 1 centimeter, and other if you look at the index, so where you calculate the all four quadrants, so it would be less than 5 centimeters. So it confirm the oligohydromnia. Okay. And if you look at the etiology, of course, here the etiology is opposite, mean there is low production of the amniotic fluid by the fetus or via the placenta, or there is a renal agenesis. Okay, renal agenesis mean if there is a renal agenesis, mean the fetus cannot urinate, so this decrease the amniotic fluid level. Or if there is placental insufficiency, mean less blood is coming from the mother side, so less amniotic fluid. So this causes the oligohydromnia. So this is you can see renal agenesis mean when there is the kidney is not developed. Okay, so this is the condition which causes the oligohydromnia, and this is the amniotic the placental insufficiency. Okay, so this is normal one. This is the you can see the placenta is the insufficient to supply the blood to the fetus. So this is the renal agenesis. Okay. And if you investigation, of course, similar, you check out the volume, check out the index, deepest, check out the deepest pocket, okay, to confirm the diagnosis. What are the complication? There is some maternal and there is a fetus. So of course, one is similar male presentation, prolonged labor due to oligohydromnia. Okay, so low fluid, so which prolong the labor, and other depend upon the cause. So if there is placental insufficiency, though other complication associated with this condition. Okay, so developmental problem, and if you look at the fetal, one of the important and the serious condition is the lung hypoplasia. So this is most common in the oligohydromnia. And the second thing is the cutaneous and skeletal anomalies. Why these are happening? Because if there is a low fluid, because you know better, the limbs of the fetus are continuously moving. So if there is a low fluid, so it can cause some injuries, and which later on cause which present as anomalies. So there are some cutaneous means skin, and there are some skeletal limb anomalies. Okay, so there there would be a cord compression or the fetal distress, and the amniotic band syndrome. It can cause the amniotic band syndrome, and IUG or intrauterine growth restriction. Okay, so there is a condition, Porter syndrome, which is associated with this condition. Okay, so what is the Porter syndrome? It's actually a mnemonic Porter itself. So if you look at the Porter syndrome, P represent actually pulmonary hypoplasia, this condition lung hypoplasia, and the O represent oligohydromnia in the which is trigger, and the twisted skin mean the skin anomaly and twisted face. Okay, and the other is the extremity defect, the skeletal anomalies, and there is and due to renal agenesis. Okay, so this is the Porter syndrome, which is due to the oligohydromnia and the renal agenesis. So what is the management? Of course, the most commonly nowadays is used is the amniotic transfusion. I mean, you give the amniotic fluid. Okay, so some fluid is given infused here. You can see here this is so this is diagnostic as well as prophylactic and therapeutic. So you can see here. So here is the fetus. So you can see there is some fluid transfusion toward the amniotic cavity. Okay. So other management depend upon the etiology the condition. So if there is the PROM mean a pre-rupture of membrane, go for the treatment associated with that, and the post-term go for the termination. If there is a lethal anomaly, of course, go for the termination. If there is fetal risk, immediate go for the immediate cesarean section. If there is no fetal risk, then go for the vaginal delivery. Okay, so here is a mnemonic which because most of students love to memorize the mnemonic easily. So mnemonic is the drip. By looking at the drip, so D represent actually demise or the fetal distress in the oligohydromnia, and the renal abnormalities, IUGR, which is you can see here complication, renal abnormality, which is etiology. Okay, and the prom pre-rupture of membrane, and there is a poster which is also complication, and the placental encephalopathy, which is one of the etiology. Okay, and there is pulmonary hypoplasia. There are not two P, there are multiple P's. Okay, pulmonary hypoplasia, lung hypoplasia, you can say, and the Porter syndrome, and the preeclampsia and the eclampsia, which is one of the etiology. Okay, so these are oligohydromnia. And these are different differential diagnosis of oversized uterus, and of course you can confirm the diagnosis by the looking at the ultrasound. Okay, so this is all about the amniotic fluid disorder. Thank you very much. Allah Hafiz.